As far as standard treatments go, from a medical oncology perspective, there is a standard chemotherapy treatment that we know is, at least so far, the best treatment that we have available for this disease. And the standard treatment is a combination of two drugs. One is a drug called cisplatin, and the other one is a drug called pemetrexed. And those two drugs are given together intravenously, and it's been shown to have the best response rates in controlling this disease. I mean, the bottom line, unfortunately, is that this is not a cure for this disease. It's a treatment, and it can control for some time, but it's a way to hopefully keep the disease in check for as long as possible, and that's why we're looking for other better therapies.
What is the best that a patient can expect from chemotherapy in mesothelioma?
Well, we can talk about statistics of this, and with the standard chemotherapy, cisplatin, pemetrexed, the median survival, and that means that the median is that half the patients would live longer and half the patients would live shorter. The median survival with this treatment is about a year. So that's obviously not a great outcome. It's better than it used to be, and so we feel that this combination of treatments is at least a step in the right direction. And there's using other therapies, radiation, surgery, we're hoping will advance that survival even more.
So that's a standard treatment. Is it going to make me sick? Is my hair going to fall out? That's not what happened to me. It was the stress of the job. But is it going to make me sick? Is my hair going to fall out? And how long does it take? How often do you give it? I think patients always ask that. Maybe we could answer that.
Yeah, sure. So, chemotherapy is very different than it used to be 20 years ago. Chemotherapy, if people sometimes think about it, it's going to make them terribly sick, and they're in the hospital, and it's nausea and vomiting. It's awful. We have great medicines to help control side effects of chemotherapy, and without sacrificing the potency of these drugs, we've been able to control the side effects much better. Chemotherapy is almost always given as an outpatient now. It's given in an office setting. These drugs are given intravenously. This particular treatment for mesothelioma is an intravenous treatment once every 3 weeks. It turns out that with that regimen, there's really no hair loss, very little. Nausea can be well controlled with medications, and most people don't even get sick. The feeling tired and run down is the #1 side effect of chemotherapy, and that's very common. It's something that patients deal with and get through, and so we get this treatment into patients every 3 weeks and with a good quality of life. So chemotherapy a lot of times has a bad reputation, but it really does make a difference, and it's tolerable for most patients.